Hey everyone, and welcome. If you're in nursing or even thinking about it, you already know it's so much more than just a list of tasks. It's a whole way of thinking. Today, we're going to build the ultimate study guide for the absolute foundation of that thinking, the nursing process. So you might want to grab some notes because we're going to build this thing together, step by step.
Now, before we jump into all the acronyms and the formal steps, let's just take a second and ground ourselves in what this is really all about. Look, this whole framework we're about to break down, it's not just some checklist. It's the structure, the scaffolding that lets us deliver this kind of compassionate, thoughtful, and effective care.
And really, that brings us to the biggest question of all. I mean, patient care is unbelievably complex. The stakes are incredibly high. So with all that going on, how do nurses navigate it all? How in the world do they consistently make the right call, the safe call, the one that's best for the patient? Well, it's not magic, it's a process.
All right, so here's the game plan for today. We'll kick things off with a big picture, the framework itself. Then, we're going to tear apart each letter of this super important mnemonic called ADPIE, assessment, diagnosis, planning, and then implementation and evaluation together. And to wrap it all up, we'll hit some high-yield NCLEX tips and a case challenge to make sure it all sticks.
Okay, let's dive into section 1. It's time to officially meet the system, the problem-solving method that is literally at the core of all nursing practice. This is your thinking framework.
And here it is, the famous ADPIE, assessment, diagnosis, planning, implementation, and evaluation. Now, this isn't just a straight line, one-and-done kind of thing. It's a dynamic cycle. It's what ensures our care is organized, that it's tailored to the individual, and most importantly, that it's safe. Honestly, you should think of it as your clinical GPS.
Okay, let's get into the first step and see how this all starts. We're kicking it off with A for assessment. And let me tell you, this is the foundation for everything. If you get this part wrong, the whole plan of care is built on shaky ground. It's all about being a clinical detective and gathering your clues.
So what is assessment, really? Well, it's the systematic and comprehensive collection of patient data. And this isn't just stuff you find yourself. It's the lab values, the diagnostic reports, it's what the patient is telling you, it's what their family is telling you, it's what you see when you walk in the room, all of it. Every little piece goes into creating this massive patient database.
Okay, pay attention to this slide, because this is a huge point of confusion for so many students. It's so easy to think a nursing assessment is just, medical assessment light. But that's totally wrong. See, a medical assessment is laser-focused on the disease, the pathology. A nursing assessment, we focus on the patient's human response to that disease. We're asking, how is this illness actually affecting your life, your ability to function, your independence? That's our territory. All right, so you've played detective, you've got all your clues. Now what do you do with them? Well, now we move to D, for diagnosis. This is the analysis phase. You take all that data you collected and you start connecting the dots to figure out what the patient's main problems are.
And again, we have to be super clear here. A nursing diagnosis is not the same thing as a medical diagnosis. It's a clinical judgment about the patient's response to a health problem, a response that we, as nurses, can legally and competently treat. So for example, the doctor diagnoses pneumonia. The nurse diagnoses impaired gas exchange. See the difference? They treat the disease, we treat the human response to it.
A patient almost never has just one single problem. So you've got to prioritize. And the number one tool for that? Maslow's hierarchy of needs. You always, always, always have to deal with the physiological needs first. Air, water, food, and then safety. Bottom line, you can't worry about self-esteem if you can't breathe.
Okay, let's put that to the test right now. Here's a classic NCLEX-style question for you. Of these 4 nursing diagnoses, which one is the absolute highest priority? Is it A, disturbed personal identity, B, impaired gas exchange, C, risk for powerlessness, or D, activity intolerance? Just take a second. Think about Maslow. What's the biggest, most immediate threat to life?
And the answer is B, impaired gas exchange. It always comes back to your ABCs: airway, breathing, circulation. Anything that messes with breathing is an immediate threat to life, so it automatically jumps to the top of the list. Now the other options, disturbed identity, powerlessness, activity intolerance, are those real problems? Absolutely. Do we need to address them? For sure. But they don't pose the same immediate threat to survival. You stabilize breathing first, then you can work on everything else.
Okay, So we figured out the problems, we've put them in order of importance, now it's time for P, which is planning. This is where we shift from analyzing the past to creating a strategy for the future. We're essentially drawing a customized roadmap for this specific patient's care.
Okay, lean in for this one, guys, because this is a super high-yield topic for your exams. There are 3 types of planning you have to know. First is initial planning, which happens right when the patient is admitted. Then there's ongoing planning, which is what we do every single shift to keep the plan current. And this is the one people forget. Discharge planning. It doesn't start the day they leave, it starts the second they arrive.
So, what's the big deal about a good care plan? What does it actually do? Well, it's so much more than paperwork. It sets our priorities, it defines clear, measurable goals for the patient, and it makes sure our interventions are based on actual evidence. But maybe most importantly, it's the communication hub. It's the one document that keeps the doctors, the therapists, the patient, and all the other nurses on the exact same page. All right, we've got our roadmap. Now it's time for the last 2 pieces of the puzzle, and they really go together. I for implementation and E for evaluation. This is where the rubber meets the road. We actually do the plan, and then we circle back to figure out if it's working.
I absolutely love this quote, Alfaro's rule. Assess, reassess, revise, record. You should just tattoo this on your brain. It's the perfect mantra for what we do. This little phrase captures the essence of nursing in action. You don't just follow orders blindly. You are constantly assessing, thinking, and adjusting on the fly. So after we've done our interventions, it's time to evaluate. And check out the most important words on this slide. The nurse and patient together. This is not a one-way street. Evaluation is a team sport. You and the patient work together to see how much progress was made toward the goals you set back in the planning phase. The whole point is to figure out what's next.
All right, one more quick critical thinking check. You do your evaluation, and you find out the patient has not met their goals. What do? A, do you just terminate the care plan and start over? Or B, do you modify the care plan? The answer, of course, is B. You modify the plan. And this is what makes the nursing process so powerful. It's not a straight line, it's a circle. The evaluation isn't the end of the road, it's just more assessment data that you feed right back into the process to make the plan better. You never just give up.
Whew, okay, we've made it through the whole ADPIE framework. Now, let's get practical. Let's connect all these ideas to how you're actually going to use this stuff, both on your exams and, more importantly, at the bedside. All right, here's a weird little memory trick for you. Asidiag o planum seva. I know, it looks like my cat walked across the keyboard, right? But look closer. It's actually a pretty clever way to remember the order of the process. Assessment, diagnosis, outcome/planning, implementation, and evaluation. It's goofy, I know, but sometimes the goofy things are what stick in your brain during a test.
Okay, it is time for our next-gen NCLEX case challenge. Get ready to put it all together. Here's your patient. He's a 71-year-old man who just had surgery to repair a broken hip. His history includes high blood pressure and COPD from a 40-pack-year smoking history. His surgery was rough, he had excessive bleeding, and he's actually getting a blood transfusion as we speak. To top it all off, he lives all by himself, and his significant other just recently passed away.
So, you've got all this information swirling around. What are you going to do first? Based on all that data, what is your immediate #1 priority action as the nurse? Think about ADP. Use that clinical judgment. And that right there, that's nursing. It's a challenge every single day, but it's also the reward. And now you have the tool to tackle it. Thanks so much for watching, and keep thinking critically.